Hey everybody, John Millen here, Millen Group. Hey everybody, John Millen here, Millen Group in Richmond, Virginia. I'm going to talk very quickly about what is an icHRA, icHRA. It's Monday, July 3rd, here in the office, nice and quiet. So, what is an icHRA? icHRA. This is going to try to give you a little accelerated learning curve on what this is. And here's my reason for doing this. If you've noticed, we are an independent employee benefits firm. We've been in benefits for over 20 years in Richmond. We have a staff of 8 incredible people. We have about 130 accounts. We're not a mega insurance agency. We're a small kind of boutique agency, but we pride ourselves on really being strategic with our clients. We're not captive to anybody. We don't get big carrier bonuses, and we're familiar with all 6 ways of financing healthcare. One of those 6 is actually the icHRA, which is the newest player in the marketplace. And here's why I do these educational sessions, is because you really should at least understand what they are. I'm not suggesting it's a fit for everybody because it's not, but man, at least know what it is and understand how it works, because you don't want to be ignorant. You don't want to find out 2 years from now that, man, probably should have paused and learned about it. Now, I'm not going to try to turn you into a health insurance agent. If you are an agent, you can maybe listen, certainly listen, right? I don't know everything. I didn't create this. This was a regulation that went into effect January 1, 2020. President Trump signed it into law and made a regulation, made it legal to do this. So that's the big thing. So I'm going to keep this very short and simple. Whether you're an owner, HR, you might be an employee listening, and you hear this and you're like, this is really cool. And you send this to the person in your company that does the benefits. And so this is a catalyst to get the word out. There's lots of different options that you can go to, lots of different people you can purchase this from. And I'm glad to help in any way. We offer this, but certainly you don't have to use us, but we would welcome that chance to at least talk about what makes us unique. So icHRA, individual coverage, health, reimbursement, arrangement, icHRA. January 1 of 2020, President Trump signed a law, new regulation that said it was then legal for an employer to reimburse for the cost of health insurance for an employee for an individual plan using pre-tax dollars. Up until 2020, under the kind of Obamacare years, right, that period of time when the Affordable Care Act and all those regulations, it was not legal for an employer to reimburse for the cost of an individual plan. Meaning, if the employer offered group insurance, and let's say I was the one person, I said, I don't want your group plan because it's too expensive, it doesn't cover my needs, I don't like it, whatever. I want to go buy an individual plan. Can you pay for that using pre-tax dollars? The answer was no. They couldn't do that. So what did employers do? If you needed to work around that, you bumped up someone's salary maybe. Now you had to be careful with just discriminating and all the regulations there. I won't get into that, but you'd be like, hey, I'm just going to pay you a little more money because you're a good employee, and go buy your own. The problem with that is it wasn't tax advantaged. It wasn't non-cash compensation. It was a taxable amount to me, federal, state, FICA. The employer paid half of FICA. I paid the other half. So essentially, if they gave me $500 a month, it really wasn't $500 worth of insurance. It was more like $300. So you had to even give them more. So that law changed that, where the employer can now do that for a number of classes in their organization. There's, I think, 10 or 11 different classes, meaning full-time employees, part-time employees, union contracted employees, seasonal employees, 1099, on and on and on. There's these different ramifications, geography changes. I won't get into that, but essentially said you could do that. This is a major shift. Now, that's not the biggest part of icHRA. That was the law that triggered the availability of it, in my opinion. I said, oh, okay, I could pay for this individual policy, but then it started a whole series of questions. And what I'm encouraging people to do is understand what it is and how it works and why it's important. And then you will see the magic. Until your brain can kind of put it into a bucket, like it's not a group plan. No, it's not Medicare, right? It's not Medicaid. It's an individual plan, but it's also an icHRA. So it's a little different than in just an individual plan. And what does this mean? Once your brain, in my opinion, this was what I went through, understands what it is and connects the dots, then you see the real magic. And it's kind of like when you look at those posters that are all fuzzy and you kind of cross your eyes, you can see a picture, and then you see it from then on. That's what I think is going to happen potentially when you understand how this works. So if you get past the mechanics, so individual coverage, this means the employer could say, hey, we're going to offer this plan. And the biggest thing is that they could pay with pre-tax dollars. The employee, if they had to come out of pocket for additional money, they could use pre-tax dollars to pay the additional cost through payroll deduction. So that you had this tax advantage now on both sides, which is a pretty big deal. You're going to be paying probably federal taxes in the range of 10 to 15, 20% nominal. You're going to pay state tax of maybe 5%. You're going to pay 15% FICA. It's split by the employer. So there's a lot of tax advantage just in that simple statement of doing that. That's the first part. The second part is why isn't an individual plan important for people? It's because of risk is the really cutting to the bottom line. Right now, the small group market, mid group market, large group market, self-insured market, level funded market, RBP, cost plus, all those different financing pieces rely on financing claims. Claims is 80% of what you spend. 80 to 90% is directly or indirectly related to claims. So you're in the claims business if you have a traditional group type setup. Nothing wrong with that. There are ways you can mitigate that. Sometimes it doesn't matter as much. I'm not saying it's bad. It's just that's the environment you're in. So if you're in an environment like that where you're getting really high rate increases, or you can't meet participation, and a variety of other things, the icHRA model takes you from that pool of risk into a larger pool of individual policies. The analogy I use is, imagine you had a swimming pool in your backyard. You invited a bunch of friends over and they swam in it all day, and some of them were stinky and nasty and hadn't showered and throwing food and drinks in there. By the end of the day, it's pretty dirty. Imagine instead of inviting your friends to your house at your swimming pool, you went down the street to the lake, and the lake had hundreds of thousands of gallons in it. It's a large lake, and you did the same thing. Would it materially change the water in the big lake? No, it's too much water. And so in that big lake, you might have 10,000 or 100,000 or more people each paying. So one big claimant, one person that gets cancer or a pharmaceutical drug or a NICU baby, doesn't materially affect it. And not everyone's having those issues at the same moment. So the lake stays fairly clean because not everyone at once is going to jump in the lake. But in your little swimming pool, you have less room for error. And all it takes is one stinky person jumping in your water that hasn't showered or is filled with mud or brings the mud with them and dumps it in. The whole thing gets contaminated and everyone is swimming. So that's a very simple analogy. You're getting out of the claims risk business by moving to the icHRA. The other big advantage is employee choice. People go to Starbucks and want one ice cube and a half a pack of Splenda and a teaspoon of cream in their Do It. It's a little extreme. But yet in the group market, the only choices we had typically were 1, 2, 3, 4, maybe 5 options, which is a lot. And then the employees had to pick from the menu. But now you have 2 and 3 and 4 generations of people, and they have different needs. And so what the individual plan does is allow extreme employee choice for them to pick what they want for them. And that's a really big deal. Now that's a shift. So you got to get your brain around, well, I pick my plan for my employees. They don't know what they want. So I'm going to pick that. That's maybe true. That's a philosophy. So this is a little bit different where you say, hey, I'm going to give you money, and could be a sizable amount of money, and we're going to let you pick your own plan in that option. That then leads me to the next and probably final piece for now. How do they pick the plan? Oh my God, that could be a nightmare. My employees don't even understand coinsurance. I get it. We see this. So my suggestion is that you use some technology to help you. You could do this by yourself and piece it together and reimburse on a card and have them buy it and then give them money. And you could do all that. It's a little cumbersome. I wouldn't suggest it, but it's possible. There's platforms you can use, and there's many of them now. They're all a little different. So you want to work with your broker advisor that maybe has vetted and understands a little bit how they work. It's an evolving marketplace. So use a platform that does all that paperwork, the enrollment, the payments, so that you, the employer, just writes a check, send it to one person, and then they pay everybody. It's very simple, and anything left over is payroll deducted. But you also want to have some people, I think. You want to have some personal touch in there because this is a new concept, and some industries probably can get away with go pick your own. and call me if you have a question. That might work for some industries. Let's say it was an employee benefits firm that were doing that. Everyone understands benefits, but what if you had 10 or 20 or 30% of your population that was a little intimidated and like, I don't know what an HMO is versus a PPO. You may want to have some people that help them to technology of the high tech, high touch aspect of that. And then you also may want to have a mechanism throughout the year for new hires, because I doubt the HR department wants to be fielding questions from Mary that lives in Colorado and you're based in Wisconsin, and they have different plans in that state, and they'd have no idea. You may want to have someone that helps them through that throughout the year as well. And those are important. So I hope this is helpful. Here's what I suggest on an icHRA. Do some quick research, get up to speed as fast as you can, and then have a proposal run. Look, these proposals typically don't cost any money when you request them. They only take a few days to go through. Sorry, nothing like getting interrupted by your son on a thing. Wanted to know we're going for dinner tonight. So run up proposals so you can see it. So that's my advice. Hope this helps. millengroup.com if you want some more information.